Yeah, when I was in the first few years of practice, there were opportunities to study cognitive therapy. So I would take those courses by Christine Podesky, Canadian Society of Clinical Hypnosis. And I also studied acupuncture with the Canadian Society with AFCI. So all these useful tools, just like what Bruce Lee said, use whatever is useful. So he integrated that in his martial arts and movie making and storytelling. I integrate everything that's useful in the care of the patient and use what's appropriate for them.
I'm in my 10th year of practice. I'm Lawrence Yang, and I'm a family doctor in Surrey. That's one of my identities. And I'm doing these conversations because I think that most British Columbians or Canadians are not privy on the direct care space of healthcare. And I couldn't think of a more experienced interviewee in yourself in terms of the health systems. You're really one of the physicians who actually tries to work themselves out of a job. You're actually trying to really empower your patients so that hopefully they don't need you very much.
I grew up in a different era, and so did my parents. My mom was born in Vancouver, just outside of Chinatown, the Strathcona neighborhood. And my dad was born in Cumberland. And at that time, it wasn't really that cool to speak Chinese. My dad's sister, Auntie Lila Wong, but then became Lila Wu. She was the first Chinese Canadian to become a citizen. So even though my dad, because she was a veteran for World War II, and that's why a lot of Canadian-born Chinese Canadians went to war, joined the army, just so they could win that citizenship for all the other Canadian-born Chinese. Before, we weren't even allowed to eat at White Spot. So my dad's days, they weren't allowed to go to White Spot.
I love White Spot.
yeah, now we're welcome there. It's part of my philosophy of life that every one of us has a positive potential. And our duty in life is to discover that positive potential and to help others achieve theirs. And that's exactly what I do as a parent and as a citizen, and exactly what I do as a family doc. Help each of my patients achieve their unique positive potential.
It really resonates with me, and part of the reason why there's silos behind me is because my podcast is called Fuck the Silos. It's about breaking down that illusion that we really that we have to be separate, and that we ought to defend ourselves against each other or insulate ourselves from the other.
I'll give you a little pearl in hypnosis. So usually when you approach a kid with the otoscope to check for an ear infection, usually they shy away from that. And a lot of kids really, any instrument that we take out, they start panicking. But when I introduce the otoscope, I ask the child if they would like to see my tickle light. Because I know they're already in a trance. They're really attentive. They're paying attention to every word, every gesture. So I show them the tickle light. And I said, look, Daddy's going to put his finger on the tickle light and see how it glows. And then I ask them, which finger would you like to put on the tickle light? Gives them a choice. And then they put their finger on top. And then as they see their finger glow and they're fascinated, I just stroke the bottom of the finger and I tell them it tickles too. And then I ask them, which ear would you like for me to use the tickle light on? And then they'll choose one ear or the other. It isn't necessarily the painful ear. And then when I introduce it to them, it feels like a little tickle. And then I have to tell them with the second ear, it's just going to tickle a little. So a lot of the kids will ask me to show the tickle light and to look in the ear, even if they're going in for a minor respiratory infection with no symptoms in the ears, they'll ask for the tickle light. And my patients that are now in their late 20s or early 30s, remember the tickle light. And when I examine the ears, I have to tell them this will only tickle a little. Otherwise, they'll be giggling and moving around too much on the exam table.
You mentioned a lot about unconditional love. Unconditional love sounds completely daunting. It sounds like they have to give all of themselves and that they have to almost burn themselves out. How do you give unconditional love without killing yourself by accident in doing so?
It's the same idea when you're on the airplane. You're supposed to put on your own mask before you assist your child beside you, because If you're out of oxygen, you're not going to get that mask onto your child or look after them either. So we as physicians or healthcare providers need to do those basics too. So I give a lot of talks on managing burnout and managing stress in healthcare providers. So it's those key basics of looking after, be a good doctor yourself. So, and that's like being a good parent. Go out and play. It means get exercise every day. Don't skip your meal. Eat healthy food and schedule that. Don't work through lunch. So make sure you have your breaks in your lunch. Get enough sleep and get some rest. So a lot of physicians don't get enough rest, but if we're sleep deprived, we're not going to make the best decisions, and we're not going to be as patient and kind to our colleagues and our staff as well. And then finally, if we're having problems, physical or emotional, then not to hesitate to go to your own family doc. So every doctor needs a family doc.
If you enjoyed that trailer, don't forget to click the thumbs up and subscribe. You can find the link to the full-length episode in the description below.